worries, explanations, questions. Consultations are built on the words, phrases and rhythms of everyday talk. Here, doctors from overseas adapt their skills in English to interact in new contexts. They also bring knowledge of cultural differences to an increasingly multicultural society.
According to Islam, if you are not well enough, so there is no need to fast as well.
In this training package, we show real-life consultations, not for their clinical features, but for those aspects of everyday communication which are difficult for most doctors trained overseas, so that they feel confident with words in action.
My name is Muhammad Alamir. I'm from Iraq. Actually, what I'm facing now, difficulty to understanding accents, different accents. I mean, language barrier is the main obstacle I'm facing here in the UK. And another thing is, it's not just a language. I mean, communication skills when you use body language, eye contact, and these things are sometimes misunderstood by local people here. So I should be aware of these things.
Most overseas doctors will work in large cities in Britain, where patients can come from anywhere in the world. Different styles of English are common, whether patients are from abroad or another region of Britain. Recently arrived overseas doctors have said they have difficulty in tuning in to Irish and Scottish accents. This patient comes from Scotland, where many of the vowels and some of the consonants sound different from standard or London English.
And yesterday, doctor, I woke up 7 o'clock yesterday, and I was feeling all rash all over, and I was sick, and I just don't know what happened. And it was there all day, and it's just in the tail end of going away now. But my fingers, everything was all itchy. I've not done a sleep last night. It's the itching and everything else.
Whatever the accent, if the words aren't clear, it's fine to check the meaning or confirm with the patient that you've heard correctly. Take a moment to reflect on particular words like
It's all itchy.
remember that vowel sound, so when you hear it again in a different word, you can guess at the meaning.
I was sick. And that's the first I realised. Itchy. Sick. First must be an allergy, but I just can't. I've retraced my steps and I just can't think, pinpoint it.
Any new washing powders or anything like
No,
that?
nothing like that. As I said, it didn't happen. It was about 7 o'clock. I woke up very uncomfortable, and scratching and all that, and that's the first I realised it.
Right.
And it was all over, and my face was pure red, and my eyes were puffed up, and that.
Right.
And all pure red I was.
When patients describe their symptoms, they often use colloquial language, which doctors need to tune into. There are some expressions like pure red, meaning very red, and it's away, meaning it's gone, that Scottish speakers use. Other colloquialisms that were used here, like the tail end and pinpoint it, are just two of hundreds of expressions that doctors will hear from patients wherever they come from.
Well, my face wasn't really too bad, but it was just pure red.
Right.
And my eyes just went a little bit puffed. Right. And I got a sore throat and that, and a sore neck.
The doctor has listened to the patient describing his symptoms and expressing his concerns. She isn't just a sympathetic listener at the beginning of the consultation, but all the way through. She doesn't jump in too early. This is a good moment for her to respond, since he's finished describing his symptoms, at least for the time being.
Some people get a rash. Well, it tends to happen more to children. They get a rash when they've got a viral infection. So
right.
some people do get that.
I just don't feel too clever at all.
Yeah.
And I say, I don't think I can think. I've had this years and years and years ago, but it wasn't as bad. I just got a little rash, but it was more or less
Have you
all
still
over.
got the rash at the moment?
No, most of it, unfortunately, it's away.
The doctor has to tune into a second problem. Again, you'll hear a mix of colloquial expressions, playing up, pure agony, and catch-22. and Scottish vowel sounds in
I couldn't go to the house or nothing. And do you realise I've still got that sore ankle? This is 3 weeks yesterday that's been playing up. The first 2 weeks was pure agony. I couldn't move. I couldn't go to the house or nothing. It's a bit of a catch-22 situation because they said come to hospital, but I couldn't even go to the house when it was bad.
When it was, yeah.
And so it's a bit catch-22. They want it when it's bad, but I couldn't, honestly, I couldn't even walk.
Yeah.
I literally crawling along the floor. It was that painful. It was ridiculous.
That's the trouble with it, yeah.
And so has
Probably
been.
have to sort of order a cab and just pitch up there. I
Yeah,
guess,
yeah, and get a
really
wheelchair
further.
or
It's you know.
Or something like that.
Yeah.
But then again, you can't just appeal at that anyway, so you know what I mean? So it's a catch-22.
Do you want me to have a little look at it now?
Yeah, if you want, yeah.
Just see
As I said, it's not too bad at the moment, doctor's just a little bit twingy.
As well as tuning into words, doctors tune into patients' moods and humour. This patient, along with her husband, has come to tell the GP about her ordeals with the antibiotic he prescribed her. Notice how she uses humour to complain about their terrible side effects.
Well, I'm quite well today, and the first 4 days of the tablets, you know, the antibiotic, wasn't too bad except for this terrible day. But after the 4th day, I dreaded it. I took them all, but I dreaded it. And one day I was very bad with terrible pain, sickness, you know. But then when Ron read the instructions, it was everything that you could get with it. I think I got, you know.
You had a full house, did you?
Oh, God.
She presents her suffering humorously by exaggerating her reactions to the antibiotic, and the GP has responded with a joke, matching her mood. You had a full house.
Because I had a toothache as well, even with the antibiotics. Ron had booked me an appointment to see the dentist, but he had to cancel it because I wasn't well enough.
Okay.
Friday I was starting, except for this terrible taste, you know, I couldn't even bear to sip a drop of water. But then Saturday, too bad, yesterday, today, I feel much better.
Did you have anything to eat yesterday?
Yes, I've
Good.
been eating since Sunday.
Good. Good.
Yeah.
Starting to fancy food again.
Yeah,
Right.
see, I went off food, I was never going to eat
You're
again.
never going to eat again. You made
But
a
then-
pact, didn't you?
Yeah,
Right.
never going to eat again.
When was the last time you actually were sick, when you vomited? How long?
About on the Thursday, or Wednesday.
Right,
was it?
okay.
Yeah, and then I haven't been
Okay.
sick since then, and the indigestion is gradually coming as well.
Again, the GP has tuned into her humour. You were never going to eat again. You made a pact. But he's also moved the consultation swiftly on by asking specific questions about her symptoms. Because he's tuned into her mood and used humour like her, these questions didn't sound abrupt.
Got to put me in today, but I've got it. But that is all I've got on me there.
Right, I'll give you some more, there's no problem
Oh,
about that.
thank you, Doctor.
Right. Good, well done.
Yeah.
I mean, we did think it might be a bit of a problem.
If Dr.
yeah.
Paul says you've got to go on more of those,
You
and
might argue with
just
him.
let me die. Just let me die.
Right.
It frightened me actually.
Oh,
when she was on
oh,
them. She had so
Oh,
many
but in the
pains.
end, you got that you dreaded taking
Yeah,
them.
well,
You know.
I'm sorry, but I
did.
think it was a useful...
I said
in the long
to him,
term,
I'm
it was a
going to
useful
take
thing.
them because.
Yeah. Just slit your coat off and let me weigh you.
The patient has continued to use humour to soften her complaint. In this way, she managed to be both deferential, but get her point across. A lot of older people do this.
That's one of the uses.
Yeah.
It can be.
Yeah.
Do you remember we did the blood test and I thought there was showed that there may be an infection called Helicobacter.
That's right. You
And
said,
so
yeah.
the antibiotics, there's 2 different antibiotics, to try and get rid of that infection.
Yeah.
Because the thinking is that the presence of the infection is one of the reasons why people get recurrence of indigestion.
But if ever there's a cure worse than illness, it's that. Doctor.
The GP hasn't patronised her with a vague explanation, but was careful to signpost technical terms.
There may be an infection called Helicobacter.
That's right. You
Just as the GP has tuned into her mood, he's also given her and her husband the right level of explanation about the tablets. Overseas doctors say this degree of patient involvement and explanation does not match their previous experience.
My name is Abdul Karim Tefi. So I came from Afghanistan. There are big differences. So one of the areas to talk about first is the power relation, if you like, between doctors and patients. Over here, patients have much more space and opportunity to talk about their wishes, what they want. So it's not like that sort of different. The doctor doesn't always talk down to the patient.
If doctors tune in, keep quiet, and really listen, they can learn much more about patients' feelings and concerns. Formulaic questions like, "How do you feel about that?" aren't necessary. This patient is in quite a desperate state. The details of her story are absorbed by the doctor, who doesn't attempt to deal with all her troubles at once.
Feeling very tired, and I feel dizzy most of the time. If I look up, I seem to lose balance. Pressure of work. I had to come in Saturday and Sunday to try and, tidy up my tray. And I'm also having pressure at work. Manager pushing all the time. She just ran me twice on the mobile. I had a duty last night and I didn't finish till 7:25. And not knowing that I had appointment with her this morning, so she ran me out. It just been bullied for the last 4 months in the office, and sorry. I'm going through marriage breakup with my husband. We've gone through the first stage, which is decree nicing. That was on the 31st of last month. And it seems that day he said that he's gonna show me in this country, that he'll show me.
He'll show you? What does that mean?
He teach me a lesson.
What does that
because
mean?
He wanted 5 years separation. He didn't get 5 years separation without, lump sum payment and property order.
That was the opening stage of a 6-minute description by the patient of her difficulties. The GP has created an environment in which the patient could disclose her feelings and cry. Sometimes long narratives cause doctors to stop listening carefully and just hope to get the gist. But Dr. G makes sure she understands everything the patient says. The only interventions by the GP were to hand over some tissues and ask for clarification when the patient said her husband had threatened to show her. Over the next few minutes, the patient describes her husband's bizarre and cruel behaviour when they lived together in Milton Keynes. She tells the doctor how her husband didn't really want her there and didn't allow her to get another job.
He didn't allow me. He said, he's not safe with me. I will bring people in, to kill him and things like that. He had his bedroom wired at the time. I could not enter his bedroom. I had to knock on the door before I get in. All this went on.
Has your husband ever seen a doctor?
I don't know.
It sounds, and I can only just say this, that your husband sounds like he's got a mental illness, to be absolutely honest. If your husband is putting, electric things around his room, he sounds very paranoid.
Well, one day I went into his room to clean up the room. I saw my picture cut into pieces, put in the bin. Those things happen, I decided to leave Milton Keynes because I was afraid of my life.
You've got lots and lots of things going on. How do we deal with them? Because with the work, do you want to take some time off work, which we can put down as tiredness, dizziness, to give yourself a bit of a breathing space?
Yeah, I've got 1 week coming, holiday. I was going to take 1 week next week.
Do you get paid if you're on holiday?
Yes.
I mean, if you're off sick.
Yes, but because I've had so much, my manager is querying me about that.
All right, we'll meet again and try and get through some of these issues because I think there's a lot going on. I think in terms of workplace bullying, I think you need to be quite strong about this, and you need to maybe just write to her and to say, and just so it's on record, that you're feeling bullied.
Okay.
All right, and leave it at that.
Okay.
Don't do any more, don't write any. The shorter the letter, the better,
All right.
in my experience.
Okay.
You need a break because you're very tired and that's what's making you dizzy.
Okay.
And then we need to talk about your husband or your ex-husband because I'm worried that he's making threats.
Yeah, this month.
Having listened, Dr. G has now suggested an action plan. She's not attempted to deal with all the problems at once, but suggested immediate action to deal with harassment at work. The doctor has maintained a sympathetic environment while also giving precise instructions. I think you need to be quite strong. I think you need to maybe just write. Notice how these are done indirectly. Suggestions are made politely by not showing too much certainty. I think, and maybe, are different in Britain.
My name is Rifat Ara from Bangladesh. So in Bangladesh, relationship is quite different. And here they can sue you if anything goes wrong. In Bangladesh, we don't have that kind of system. So, in terms of doctors dealing with patients, they don't have to worry about that.
Doctors often have to work hard to achieve patient satisfaction. Building trust is important with patients like Mrs. K, who is anxious and confused. Her daughter is there to help her. Mrs. K was in hospital briefly the previous week with chest pains and has come to the surgery because her chest pains have returned. Early on, the GP establishes from the hospital discharge letter that she hadn't had a heart attack.
She came down here and they sent for an ambulance.
I sent an ambulance from here
and took her
to hospital. And they had all these tests, injection,
and they
sent me home.
Following day.
And today I feel.
She doesn't feel
all right today.
What's happened?
Since this morning, I feel my heart is.
It's not a chest pain. It's like a murmury feeling.
Doesn't feel right, is it?
And last night I had a pain on my leg, So.
And they've given her lots of different tablets
and
now.
They give me.
She's a bit confused with.
I'm confused. They give me so many tablets. I don't know which to stop and which to take.
Throughout, the GP has to take account of Mrs. K's anxiety. She's stressed because she thinks she has had a heart attack. He has listened to her and let her repeat aspects of her story. Notice how he twice gave her the opportunity to tell more of her story. What's happened? Doesn't feel quite right?
Can you tell me about this pain? Does anything make it worse today?
It's not pain there. It's inside there.
Right.
And so the time is, I can feel like water running, water running in your heart. It goes down.
Right, okay.
It's probably like that.
And
That's it.
does anything make this pain worse? Did you walk down here from home?
Yes.
No problem?
No.
And are there steps at home, staircases?
Yes, I got 12 steps.
And you went up and down today?
And I
No
I
problem.
don't feel any pain or
She doesn't actually get breathless.
nothing. No,
And
never.
but the pain didn't get any worse.
No.
Used to go in buses and
So it's a kind of a
some
discomfort.
shopping, and I never feel any.
So it's more like a discomfort, really, isn't it, rather than a pain?
The GP's style has changed. He has used focused questioning to establish the precise symptoms, and that it's more discomfort than a pain. The GP reassures, explains, and manages the consultation by sharing information with the patient and by a lot of signposting.
What they would have said it
No, I
was
mean
not
this
your
time
heart.
when I went the second time.
Yeah, it wasn't your heart this time. All the heart tests are normal. That's what it says in the letter.
Did they say?
Yes.
They never said anything to me.
Well, do you believe me?
Of course I believe you. If I don't believe you,
No.
If I don't believe
But you look,
I tell
you look a
you.
little uncertain there.
Yeah.
Right, now that we've just clarified that one. Now, if it's not your heart, then we have to think it might be something else.
One thing I got hernia as well, isn't it?
Okay, but it's not that either.
And when they examined my tummy, they found that it was
Very swollen.
very tender.
Very tender.
And sometimes
Might
I
be a
go
bit.
sort of like that.
But what it is you're tender pressing on these muscles here and these bones. Because when I examined you there, you were very sore. And it might be that you've got two problems.
So what?
It might be that there are two problems.
Two problems.
Okay.
As long as it's only two.
As long as right. Now, one problem is that you've got tenderness in this muscle area and over this bone, and we should do a blood test just for the bone, looking at the problem in the bone. That's one.
And
I think it'll be okay, but we should do.
when
it.
I, sort of, I got trouble too. I got this.
Well, let's leave that now for a sec because I just want to finish the other one first, or I'll get confused. Now, the second is you're under a lot of stress, and I was just looking in the record, and one of the reasons you got this chest pain last week because things got a bit hot between you and your husband. So, the other question I'm wondering is whether, and this is a difficult question to answer, I know in many ways, but whether things are okay at home.
All this signposting has helped both sides focus on priorities, while the GP still attends to Mrs. K's anxieties.
My name is Adila Qureshi. I'm from Pakistan. There is a lot of difference in the medical care from here to Pakistan, but I think the main difference which I observed is there in Pakistan the doctor has got the authority for everything. For example, taking decision of management, about the drugs and about the patient as well. Here the doctor discuss with the patients as well about their treatment, about what is going to be next, everything. I think that's the main difference.
Building trust is an important ingredient when patients resist the doctor's plan. This patient has diabetes and has come to get the results of his blood test.
Do you do your own testing?
No, I don't really.
Do you think you should?
But I come to know when it goes up. That's how I just come to know.
How do you know?
Well, my body tells me, speaks to me. Then I feel better. I know it is,
How do you feel at the moment?
I feel weak at times.
Mm.
That means my diabetes, blood sugar is up.
Mm.
But then I sometimes feel energetic, so that means things are a bit better.
Mm.
So,
how would you feel about having a session with a nurse and for a period of time testing, doing the blood test? Not saying forever, I don't want to get into that, but I would like to see, I'm not distrusting your feelings, but I don't know about it, but I don't know that they're accurate enough. And just for a period of time, I'd like to know what the sugar levels are doing. It would help us to advise you and also think about your treatment.
Okay, if you think...
Is that all right?
If you think it's necessary.
Yeah, I do. Just, I'm not saying you have to do it forever and ever, but just for a period of time to let me see what's happening.
The GP has suggested the patient should start testing his own blood sugar levels. Notice the way he structured his request to the patient. I still think we need to. Then asks about testing. Do you think you should? Then, how would you feel about having a session with the nurse? Persuading is usually most effective when done indirectly, so the patient doesn't lose face.
I'm going to ask the nurse to see you. I hope she'll be able to see you. We've got a nurse off today, so it's a bit busy. I'll just go and have a word with her, but maybe either tomorrow or Friday, just to go through the testing with you. And I'd like you to test perhaps every other day.
You have to send the samples to the...
No, for you to test at home. It's a little finger prick.
Oh, I used to do it myself.
I know you did, I know. Well, I want you to do that again. I just wanted to go through it.
I don't like that.
I know.
I think there's some more advanced things now.
No. Well, you can discuss it with the nurse. She has much more up-to-date information than me. But I don't want you to do it every day, but I'd perhaps like you to do it every other day. I just need a picture for a week or two of what your blood sugars are doing, you see. I'm not asking you to do it for all time.
Notice again the indirect ways that the GP has proposed action. I would like you to... And he's again repeated that this was a temporary measure when the patient resisted. Overseas doctors are sometimes concerned about admitting that they don't know the answer to a patient's question. But here, Dr. P is quite happy to refer his patient to the nurse, who is a specialist in this area. The authority of the UK-based doctor is different from that in other countries. Here, doctor knows best has to be worked for, negotiated. Doctors have to inspire trust and confidence in patients. The doctor's authority is not taken for granted.
I would like the nurse to see you.
Every day?
No. I'd like her to see you to just go through doing the blood tests for a little while and recording them for me. And I'm going to put you on an increased dose of glabenclamide, and I'd like to see you in 2 weeks' time, and you'll have a little paper with some figures on it for me. Okay. All right? We don't have to do this forever and ever, but we need to do it now.
Okay.
Is that all right?
Okay.
Are you cross with me?
But I just don't like it.
Dr. P is quite firm about the importance of testing. But once this is agreed, he and the patient have a little joke about the fact that the GP has persuaded him to do something he didn't want to do. Outside agencies are often part of the solution when patients have complex problems. This patient has MS. She's brought along a friend who's keen to make sure her social problems are dealt with. She initially presents with an itchy ear.
The skin that lines the ear canal looks a little bit inflamed and red, and that may be why it's causing some itching and pain for you. When I look inside the ear, I'll draw what happens.
The doctor, she has a similar thing on her hand.
Oh, right. Right. How long's that been there for?
Oh, the last was to put something.
Yeah. Does that itch at all?
No.
No. Is that something that's been there for many years?
No, 3 years.
No.
Weeks, months.
Weeks, okay.
Months.
Maybe a little bit of skin irritation, again, a sort of eczema, because that's, I think what's in the ear looks like a little bit of eczema as well, really. When I look in the ear here, that's the ear canal. So when I was looking down, I could see the inside ear, the eardrum here. Now this is all lined by skin, so the same as the back of your hand. And in the same way as you can get eczema there, I think there's a bit of eczema inside the ear. So what I'll do,
Notice the detailed ways in which Dr. B has explained what the problem is, speaking slowly and using a drawing. But the friend wants to get to the real reason.
Okay.
Now, the real reason why she came to see you is because she has she has money given to her because she's got this multiple sclerosis.
Right.
But they cut the money down.
Right.
Because the daughter became of age, I don't know, 18 or something. But her daughter is studying exam in a school, and she studies hard, diligently, with determination, and she can't work to keep it. It's very hard for her to have this small reduction of money that she had, you see.
Yes. That sounds like the law. What happens, I think, once a child becomes an adult, which at 18 your daughter is, I think what happens is that the Social Security feel that you're no longer responsible as such for your daughter, even though she's still living at home with you, and so they cut some of the child benefit that is built into the money that you get, the living allowance that you get. Is it disability living allowance we're talking about?
What do you get disability?
I get disability and I get disability and incapacity.
Right.
The patient gets disability allowance and incapacity allowance. Dr. B has listened sympathetically, but since this is beyond her expertise, has suggested an appointment with the benefit officer. The important thing here is not that doctors should know all the details of the benefit system, but that they know who they can refer the patient to.
We've actually got a benefits advisor that comes to the surgery. And it says here that you're asking for further information regarding advice about your benefits. I was going to suggest anyway that seeing someone here to discuss that problem and to see whether you're entitled to anything else, whether you could have different benefits. I think it would be sensible for you to see the person that comes here to the surgery, and then you can discuss the problem with them and see if there's anything else that can be done. Would you like me to arrange that for you? Yeah.
We have seen that Dr. G and this patient have agreed on an action plan. Dr. G is firm and precise about the next steps.
We'll meet again and try and get through some of these issues because I think there's a lot going on. I think in terms of workplace bullying, I think you need to be quite strong about this, and you need to maybe just write to her and to say, and just so it's on record, that you're feeling bullied.
Okay.
All right, and leave it at that.
Okay.
Don't do any more, don't write any. The shorter the letter, the better, in my experience.
Okay.
You need a break because you're very tired, and that's what's making you dizzy.
Okay.
And then we need to talk about your husband or your ex-husband, because I'm worried that he's making threats.
Dr. G has earned her authority. She has not imposed it. Similarly, in the next extract, she earns the right to get close to the patient and help build her up again before the patient has to face the world beyond the surgery.
Let's meet again, maybe next week. All right, and we'll take it quite gently. But I think the dizziness you're getting, the tiredness you're getting, is because you've got so much going on, haven't you? Yeah? Are you sleeping at the moment?
Not very well. I keep waking up.
I bet you do. I think
that might tell me to.
I think it may help just to give you some sleeping tablets, just to make sure you sleep. Okay? Because if you don't sleep, you feel worse. Just waking at 3 a.m. makes you feel completely worse.
The consultation finishes on an upbeat.
Sorry.
Listen, it's what we're here for, isn't it? But it sounds like you've got awful things going, so many things going on. Get some sleep, and then it'll start to get better now. You'll feel better, by the way.
In fact, things have now got a whole lot better for this patient.
Well, you've dumped some of it, Okay?
Thank you.
Bye.